Probably the patients that are most impacted are those who are trying to stay healthy but cannot stay healthy because they cannot work out without their asthma being exacerbated, without their coughs being increased. Such contaminants in the environment certainly do decrease the fitness level of people in general. As a result, people are not able to work out. Even indoors, they still are breathing the contaminated air.
Well, the things that I've seen mostly and most obviously and directly are the people presenting with asthma symptoms.
I think I see more people with allergies and sinus problems and asthma, COPD that worsens. Over and over again, they're saying, I don't know what's different about this year, but I'm in absolute misery. Everything is reacting. My sinuses are killing me.
You know, probably the most common issues I think would be more around the respiratory issues. So thinking about a lot of patients who have asthma do tend to be patients who don't have great health insurance or great coverage, and so it's difficult for them to get their inhalers. And so I worry about that if they're having trouble treating. You know, a lot of people will skip their inhalers even because of cost, and so if that's going to be more frequent, people are going to be sicker.
Mainly respiratory I see in my area right now due to air quality. And I think in effect also there's sleep problems, like in the heat. We've had really high temperatures, abnormally high. So I have patients who don't have air conditioning, they can't sleep, it causes stress, poor work performance. So there's kind of this cascading effect.
Probably there are two factors that I've seen change. The first is an obvious uptick in the amount of Lyme disease that we see and that we treat, along with other vector-borne illnesses, particularly tick-borne illnesses. Obviously, some of that is due to habitat change, not just climate change, but the seasonal changes seem to have some impact on that as well. The second factor we've seen change, or the second illness we've seen change, has been an increase in the amount of allergies that we treat. The allergy season starts sooner and it goes longer, and there's more crossover between the trees and the grass pollen.
Well, I practice in the desert Southwest, the northern border of the Chihuahuan Desert, and so we're not very prone to hurricanes and things like that. But unfortunately, with drought periods lasting longer and being more severe, we have had issues with wildfires. And I tell you, nothing aggravates an asthmatic worse than a wildfire. The soot that's in the air is just very irritating. And normally in our area, because it's a desert, there's not a whole lot of pollen. So usually, in fact, there are people that have come out there just to get more relief from their respiratory issues. But if you've got smoke in the air, then it just negates all the good things about having them in the desert.